to you all today about thermography. So you should be seeing, can I just get a thumbs up if you're seeing the Get to Know Us page, just to make sure that I'm checking out okay with my presentation materials here?
Yes.
Okay, perfect. Thanks, Diane. Thanks. Okay. Well, great. Well, welcome everybody. Yeah, this is me over here, obviously in the far right red. That's some of my biographical information that Naomi just read for all of us. But specifically, I wanted to share with you today the reasons for, well, a little bit about myself, my background, and my practice background, and the reasons why I introduced thermography into our practice several years ago. So thermography is something that I was educated on as a young person by my own mother because it was something that she was using as a part of her wellness regime. She was in the process of utilizing it to make sure that her breast tissue was healthy and was maintaining well. And I'm going to tell you a little bit more about how it works so that you can get a better understanding of why somebody might do that. Because what we're educated and how we're educated today and currently is mostly on mammography. If you'll give me a raise of hands, how many of you are willing to share that you've actually done some kind of mammography testing before? Okay, great. A couple of you, perfect. And that's the traditional method of what was called breast cancer screening. And mammography is becoming more and more utilized by the Western medical system as a way to not only detect, but now they're using it more in a capacity of actually screening. So many young women out there are getting the recommendation, you might be one of them, to do breast screening every year, which means for them a mammography session test every year. And that is so that we can rule in or rule out a potential cancer diagnosis. And this is the way I'm starting here because this is the way thermography is best known for people is through breast imaging. So I'm going to start there, but I'm going to also share with you some other ways that thermography is used out in the medical professions out there. So breast imaging via mammography itself is always to detect and say yay or nay to a cancer diagnosis. But the reality is that cancer doesn't develop overnight. And if you think about the current model and the current practice of using mammography as a screening tool for an annual, reveal of whether or not the cancer is diagnosed or not this year, it's a bit of a challenge because we have a situation where we're now increasing the exposure to one of the downsides of mammography, which probably many of you have heard, is the radiation aspect. And even though it's in small, minuscule amounts, and it's approved to be safe, one of the things that we don't often discuss inside the context of doing annual mammography is really the exposure to radiation. And radiation is a known carcinogenic, or means carcinogenic means something that can cause or has the potential of causing cancer in the body. So when we increase that amount of exposure to radiation, it could potentially aggravate the scene. The other challenge with that scenario is that you're still not answering the question in terms of how is the breast tissue doing? Okay, and that's where thermography as a tool can be very helpful. It's not a diagnostic tool. It's not something that is approved by the FDA for ruling in or ruling out cancer, breast cancer, or cancer anywhere in the body. So that's really important to note. It's not a diagnostic tool. It's a screening tool, and a screening tool specifically in the context of determining how healthy tissue is inside the body. Some people call that a physiological viewpoint of the body. Physiology meaning what's the temperature, what's the flow of blood look like, what's the comparison between two areas in the body. Inside the body, you should have symmetry in your body. So that means the left side should look somewhat reflective of the right side. And so thermography gives us that viewpoint in terms of is the left to the right side symmetrical in nature. Okay, so I'm starting to get in, just jumping in with a little bit of the technical aspects and trying to start really from where some of the common viewpoints of and making some clear distinctions on what thermography is and what it isn't. Okay, we're going to dive into that a little bit more. I'll back up for a second here. You've got a screen in front of you right now that shows you who we are as a team, and the Paramount Wellness is my my corporation practice, my global practice, and then Thermimage is actually our subsidiary that does thermography testing. So on the left there, you have Katie Benicki, excuse me, Benicki, and then you've got Christine Horner, and you've got myself. So I oversee the delivery of the services. Katie is our certified thermographer. We're located in Englewood, Colorado, so Hamden and Santa Fe. We have a nice office space there on the 8th floor, and that's where we do all of our imaging currently. And then Dr. Christine Horner, she's a medical doctor. She's actually out of California. She's written multiple books on breast cancer, how to deal with it. She's got an interesting story. She's a former breast cancer surgeon. And so she was literally in the business of basically removing breasts from women. And she did that day in and day out. That was her main surgical procedure. And she got to the point where, one, she was kind of tiring of that. And then the thing that really pushed her to take a different course of action with her career was when her mother became ill with breast cancer. And she was a firsthand witness to the process of having to deal with breast cancer more from a patient perspective. And so she really saw the need to get into action in a more proactive way. And she actually she was a well-paid surgeon. She turned into a healthcare professional that basically she does her own thermography imaging now in San Diego, but she also does interpretation of the thermography images for us and for other practitioners across the country. She's also appeared on Dr. Oz, talking about the importance of breast cancer health and prevention. And so she's pretty well-renowned figure in terms of prevention of breast cancers. And then there's myself. Again, I oversee the practice. I'm the main practitioner in a process of what we call the resiliency method. Inside of our office, I do acupuncture as well. The resiliency method is a trademark process that I have devised myself. I just realized Christine is missing a T in her her title there. Oops. And I oversee the practice and am a chief clinician with a couple of associates in there as well, performing clinical procedures. And we'll probably have an opportunity to talk a little bit more about the trademark process that I have developed called the resiliency method at a future date when we have another topic to discuss at that point. But today we're going to stick with thermography. But I want to share with you my own personal experience just with this scenario, because again, not to overdo the breast tissue conversation, but it is a really important one in the context of thermography, because that's the most widely used application of thermography when it comes to health. And I want to share this with you because one of the reasons I started getting thermography at such a young age was because my doctors told me that I had fibrous breast tissue. And so that meant that my breast tissue was really dense. It was really full of probably excess estrogen. Blood didn't move super well through my breast tissue. And there was more of an increased propensity of developing some kind of issue with my breast tissue as time went on. So my mother had encouraged me strongly to get out there and start to get proactive in looking and screening at my breast tissue. We really would do it every couple of years to just ensure that everything was looking healthy and normal. But it really wasn't until I introduced the process of the resiliency method in terms of dealing with my body, my whole body, not just my breast tissue, but working with that process to find nutritional healing that happened over time, took place over time. And now I'm at a point where I no longer have dense fibrous breast tissue. And that can sound like a pretty like just a description of somebody's breast tissue, but when you're actually the person where you've been told that, it's really scary. It's really scary to be told by doctors that you have more potentiality for developing one of the most common cancers known to us today in our modern world, and or modern in our country, I should say. And so it's one of those things that is definitely lays in the background and cause a little bit more of a fear to exist, which isn't very good to carry that type of fear around for your health in general. So thermography really became a tool for me personally too, to really ensure that it was something that was working well. Thermography is actually has been proven to be able to show changes in breast tissue that have cancer potentiality 7 to 8 years before you'd even get diagnosed. Okay, so imagine if you had that information, not just about your breast, but anywhere in your body in terms of knowing where tissue changes were occurring, or maybe where there was inflammation that was tending to be more chronic. And as we're going to get into in just a moment here, as we look through some images, even just some scenarios where you knew that blood wasn't getting to a particular area of your body, and that could cause some level of cell changes in that tissue, in that area over time. So it's really a fantastic way to get real preemptive and really proactive about what's going on inside your body. I'll pause there for a second. Does anybody, I know we're going to leave questions to the end, but if anybody has a question right now after I've spoken for a little bit there, I'd love to hear that. Or if you have a particular question as I've been talking, love to hear from you there too. And I think we've got Naomi on the chat as well, monitoring that for us. I'm going to peek at it myself. Okay. Don't see anything so far. All right, well, let's keep rolling. So I want to share with you some images, because I think that's one of the best ways to really understand, one, the application for thermography, and two, just what we're looking at when we're talking about the images themselves. Okay. All right, so in front of you here, you've got some information that's taken via the hands. And I want to point out a couple of things to you, even just looking at the hands themselves, because this is going to give you some information about temperature variation. So one of the things that you'll see is there's different shades, right? There's blues, there's greens, there's yellows, there's reds, there's oranges. Well, just like on the rainbow, some of these colors start to, red, a really deep red at less of an issue is an orange kind of thing. And then orange is, at a lesser of an issue, a yellow color, right? But red typically, or anything along the red spectrum, would indicate some excess heat in the tissue itself. Whereas like over here on the right side here, you see blues and purples and such. Those would actually be indications of cold. Okay, so neither one of those in of itself is necessarily a cause for alarm. But what we can see is that when we look at certain aspects of where temperature exists in certain tissue in certain areas of the body, we can start to see patterns, and then that would give us some indication about what might be going on at a physiological level. And you can even do that inside the hands. So this is a good example here. This image here on the left gives you some information about what might be indicative of a situation where a person has high blood pressure, and most significantly marked by the fact that the tips of the fingers are red, which means that there's some systemic inflammation going on. What we know from a Chinese medicine perspective is that the tips of the fingers are the ends of where, and by the way, Chinese medicine, I'll talk to you a little bit from that perspective, because that's definitely my background in doctor of Chinese medicine and acupuncture. But I just want to level set with you about what Chinese medicine is, because I think people sometimes get an impression that it's some kind of alternate system that you have to have a completely different view of the body when you're talking about these channels and meridians and such. But the truth about Chinese medicine is it's just really the study of how everything is connected to everything else in the body. And the Chinese in ancient times, it's over 3,000 years old. Some people estimate maybe 5,000 years old. To put that in comparison, Western medicine is just over 400 years old. So it's a very ancient, time-tested process of looking and working with the body and understanding how the body works. It's not something that we as Americans often hear of very often, or approach it that way, because we're very much embedded into the pharmaceutical model of medicine, which is, like I said, about 400 years old and is very focused on, health from a standpoint of a needed drug or a needed surgery kind of aspect. So if you're taking a little further back perspective on health in general, looking at principles of Chinese medicine and going back to where the Chinese really started to understand the human body was through dissection. So that would be opening up cadaver bodies and actually looking at how certain organs and certain structures of the body were connected, and also where they went in terms of their blood vessels and their arteries and so what they have actually, the meridian and channel theory of Chinese medicine really comes primarily from that. So the fingertips themselves will actually mark. So for example, in the pinky finger itself, especially on the exterior edge, there's actually connections to the tissue of the small intestine. So that's another interesting tidbit about this. But this is the pattern of somebody who might have some marked blood pressure. This is somebody who might be indicative of lots of heat in the hands of diabetes. And then this would be an actual more of a normal aspect. Okay, and you can kind of see where these temperature variations will change. And this is, and remember I said something about symmetry between left and right side of the body. Well, on the right side over here in this knee, you can see that there's a pattern of some red, which does not exist on this side of the body. And then the same is true for some cold that's indicated by the blue. Okay. Now I mentioned that red is oftentimes sign of heat, inflammation. And this is where I'm going to potentially differ from what you might traditionally hear, even from other thermographers and or natural health providers or functional medicine doctors or even your medical doctor. Inflammation is as a term that all of us are probably aware of, and certainly is something that is looked at as being like the root cause of so many issues. But I'm going to challenge you to kind of rework that a little bit in your mind, because yes, while inflammation is a problem, oftentimes our body will create heat as a natural way, or a little bit of inflammation as a natural way of actually healing something in the body. So the difference between good and bad inflammation, imagine it if it's a fire that you're doing to burn some leaves in your backyard. The difference between a good fire to dispose of those leaves and a bad fire, where you're calling the fire department, is that it's a controlled burn versus a out of control burn. Or a raging forest fire, if you will. So inflammation of itself is not a bad thing as long as the body's able to keep it in check and use it in a directive way to actually create a healing response. Because that heat and that increased blood supply, that's what that red would indicate, is directly correlative to what the body's innate intelligence is designed to do. And it's a beautiful thing, is to see an area in your body and go, I don't like those cells. I don't like what's going on there inside that tissue. I'm going to send some increased blood with all the important components that come in blood that have healing properties, such as white blood cells, such as the red blood cells, such as the neutrophils. So all of those things inside your body are useful to actually create, even cholesterol, which is another topic. That's another one we could do, Naomi. It would be a good session. Even cholesterol is a useful product inside the body to actually deal with inflammation and deal with healing. inside the body. So too low of cholesterol for your body, and this is sometimes the side effects of statin medications themselves, is and many people discover this once they get on a statin. They're like, I all of a sudden feel like my joints hurt, my pain levels have gone up. And that's because you've reduced the cholesterol oftentimes in such a case where the body is struggling to keep up with that need for healing, which is inflammation. Again, controlled burn versus out of control burn. So in Chinese medicine, we would call some of those heat patterns, and I'll show you a few more here. Here's some varicose vein pictures. So you can see the red indicates, again, just increased blood supplies. It's not always a bad thing to see inflammation or red. It's just giving you information about where is the blood and to what degree. And inside of varicose veins, if anybody's ever familiar with those, with varicose veins, you oftentimes have blood that's not moving as well as it should. Is maybe a little bit more thicker in consistency, that it's causing increased pressure on the vascular tissue, and then that increased pressure elevates it up to the surface of the skin, and so then you start seeing those veins. Again, just seeing them here isn't necessarily enough. What we'd really want to know is why is the body doing that? And that would be how we would use thermography to really understand where is the blood not moving really well, and then that would lead us to doing some more discovery on what's causing that situation. Here's a few more that I want to show you on the head, the neck. I will tell you too, while we're looking at the head and the neck, that oftentimes thermography is really good for picking up chronic dental infections. These are showing more like just the view of the lateral head and the head. Nothing necessarily significant. It's worth noting too that sometimes the blue, I'm going to talk about the blue and the purple patterns in a moment here, but sometimes those will show up just because of some fat on the cheek too. So it's important to consider, what does the person not only look like on their imaging here, but what do they look like when you look at them as well? If they are carrying a little bit extra weight, then sometimes you're going to expect to see some of that differentiation in color. This is an example of showing some potential inflammation in the thyroid. When you see some of the red markings around that thyroid, that's often an indication of some inflammation going on systemically as a result of some thyroid issues. But as I started to say here too, and I thought I had a picture of one, but maybe not, the teeth are oftentimes really important. This to indicate if you see some discoloration around the gums itself, sometimes you can detect that there's actually a potential issue with teeth. And I'll show you some of that. We can get into some more detail there if anybody's curious about that, because the teeth are actually correlated to many of the organs in the body, and even the spine. Along the spine as well, you can see correlations to certain teeth. So sometimes if there's an infection in a tooth that's not dealt with, we'll pick it up here on thermography, and that's something that somebody can work with their dentist to get under control. Okay, few more of these, looking at the carotid artery, looking at the head. Measuring infrared temperature. And one of the most important things I want to give you too about thermography is, again, not just seeing where there's heat patterns and not just seeing where there's cold patterns, because a cold pattern would indicate that there's a loss of blood, again, to that particular area. So just like there may be too much blood in a particular area, I wouldn't say too much, but in the case of varicose veins, that would be an instance of where you're saying there's too much blood, because it's more of an indication of that the blood's not flowing as readily, or might be consistency wise could be a little bit more thick than what we like to see. And then sometimes with varicose veins, it's because the vessel itself is really the tissue that's holding the container that's holding the blood is also the problem. So in any case, the too much blood or too little blood is potentially a problem, and that's where thermography can help us detect those patterns. Because if you're lacking in blood to a particular area of the body, that means you're also lacking in important nutrients, and like I said, the important components of the blood that come along to heal the body. Okay. One of the things I want to mention about measuring the infrared temperature, it's again, not just looking at symmetry, even not looking at just hot and cold, but actually what the thermographer, Dr. Horner, will do is actually go up into the area. She has a whole computer. She'll take the images and she has a whole software that she then puts them into, and then she can go in and interpret them. And so for every image that we take inside of our office, we send it off to Dr. Horner. She goes through and does the interpretation to look at the patterns and then give a summary of what she's finding and then what the findings are. And they're usually, depending on which study you do, 3 to 6, 7, 8 pages long. When we're looking at what patterns were detected inside the body. But one of the most important distinctions of the temperature variation itself is that we're always looking for anything that is 1.5 degrees Celsius or more as being a significant finding in temperature variation. And by variation, I mean looking at that hot or that cold area in the body and then comparing it to the tissue that's right up against that area itself. And if that differentiation between what would appear to not be the red or the blue area, if you will, to simplify it, or would be, is if that differentiation between those two areas is 1.5 degrees Celsius or more, it's considered a clinical finding. Okay. Breast tissue, and again, this kind of started out with spending a lot of time here. And this is where we'll often see some of the signs of even like hormonal dysregulation happening in the body. So this one gives you a picture of what it looks like before or after a hot flash kind of deal, in terms of, you can see on the chest there, increases of patterns of heat are coming along here. Okay. And then these are some pictures of the abdomen. We can detect certain aspects of digestive issues going on. Again, this isn't going to be indicative of why the body is allergic to a certain food or why you're having necessarily abdominal pain. It's going to give you an indication of, okay, there's some abdominal pain going on and here's where it's stemming from. Back here. Okay, showing just different areas and how we can be used. Chest, both on male and women, men and women. And then these are some interesting ones. This will show you some patterns. You see the heat coming up right there on those images. It's an indication of acid reflux. And then heart disease here. These are also kind of interesting too to look at, because again, it's not going to be the root cause to addressing why the heart tissue is challenged. And I'll give you a hint, it's not always just about diet and exercise. But there is some indication over the heart here. You can see that this is a good example of the cold pattern. So a disease is a disorder with time, right? So some types of cellular changes start to happen, and then over time that becomes more and more chronic, and that's where we see some of the cold patterns show. So in this particular image, you can see there's cold patterns over the heart, and that's consistent with the fact that this person would have heart disease and be in that position. And you really want to look at and consider, because just in the same context of what I was talking about with breast tissue, right? So with breast tissue, you're like looking at the body and you're looking at that tissue and detecting where there's changes, oftentimes 7 to 8 years before you're going to like actually get the gavel, I call it, and the diagnosis. So you can be in action around addressing those tissue changes. Same goes for the heart. So imagine if we had a system like we do with thermography to really understand, are there changes starting to happen in that tissue? And then we can start getting proactive, because just in the same way, heart disease is not often detected on people until there's either a major event. If they're watching blood work, you can get some better indications of some things starting to happen there. but this is another way to really indicate how much tissue damage is there, not necessarily just how much cholesterol is in the blood, good cholesterol versus bad cholesterol, how much inflammation do we have in the blood through looking at, A1C, things, some of those markers for heart disease that can give us some information about inflammation. This will give us some, is there actually tissue as a result of those things going on inside the heart itself? Okay, so we offer full body imaging. We offer breast tissue specific screenings and upper body scans. I always recommend people start with an upper body scan if you've never had thermography before, because it's a way to not just get the breast and the chest in there and looking at breast tissue and or heart, but it'll actually get your abdomen as well. And it'll get your thyroid and your head. Those are the areas where most of our major organs are located. And so it gives us a picture of all of that. And then if you've got any like leg, feet stuff, sometimes the full body scan is a good place to start too, because it'll get all the legs, the feet, and the arms and hands as well. Okay. I want to also direct you to our website, ThermaImage, because there's a lot of information on here too in terms of how it works. So this is a great resource to take a look at. And it'll give you a little bit more in-depth information about thermography, and then what's needed to actually start to look at it. And anytime somebody does an imaging scan with us at our office, we also give you a free review with that with one of our clinicians. And then also we give you to go over the report that Dr. Horner would produce is what I'm saying. So we don't just give you the report. We actually will sit down with you and just point out, some of the things that are important to note. Dr. Horner will also give a recommendation, excuse me, based on what she feels, based on your results, what's a good follow-up time frame. Oftentimes when you've done thermography for the first time, what she wants you to do is actually get a follow-up image within 3 to 6 months, typically. If it's usually 3 months if she finds something that's, of significance. And then 6 months, just because it's the first time you've ever been imaged. And so it's really helpful when you're looking at thermography to look at 2 different points in time and understand what are some of the patterns that might be just a result or correlation to what you have going on in your body that might not actually necessarily be abnormal, but might just be more of like your body. So sometimes we'll have like a major vessel or a vein that's a little bit more pronounced in a particular area. And to see that that is present in both of those images is relevant and useful information to get the most out of the imaging itself. Okay. So I'm going to pause there. I'd like to open up to questions if anybody has some right now. Go ahead and take yourself off of mute. Deborah has this question. Insurance does not cover this. Good question. Currently, insurance does not cover the cost of thermography in most cases. I always recommend to people that even despite knowing that you actually reach out and ask that question of your insurance provider itself, because one of the ways that insurance carriers will start to cover procedures is if there's enough demand out there. And so if you as an insured, actually, even though I'm giving you the answer, Deborah, reach out to them and ask that question yourself and make a recommendation that they do that. You can use FSA and HSA funds oftentimes to cover the cost of these things. So I would recommend definitely taking advantage of those benefits. I know sometimes the FSA and the HSA funds will run out. Yes, Naomi, yes, correct. By the end of the year. So it's something to consider if you're interested in doing this this type of technology, you might want to consider getting the imaging done before the end of the year so that you can really understand if that's or you can really get take advantage of those tax-free dollars that you've set aside in those programs. Great question. What's another question out there?
I'll just come off mute real quick.
Sure.
So you do a baseline images, and then you come back in 3 months if there's something significant. You come back in 6 months otherwise, just to see if there's any kind of pattern going on.
Right.
And then from that point forward, how often is it recommended to get thermal imaging done?
Yeah. So generally, I would recommend it. It oftentimes depends on findings too, right? So if you're like middle aged, meaning past 35, I would say that getting into a habit of doing at least your breasts annually is a good strategy to get into, and that's probably the ideal scene, assuming there's nothing to be found. That would be the most ideal scene. Cost aside, every couple years would be the next best. You know what I'm saying? So really, like if you're looking good when you get that imaging done, then every year to two, I'd be repeating the test in general. Again, you're doing the imaging through your medical doctor. Insurance covers the mammography, but it's a different question you're trying to answer, which is, do I have breast cancer? Well, by the time, how many of you have known somebody that's gone through breast cancer for issues themselves, or you've been witness to it? Yeah. The cancer journey itself is not really a fun one. So I know that's one of my motivating factors to try to stay healthy is I really don't want to have to spend my life savings on dealing with a major medical issue in 20 or 30 years from now, right? And I have aging parents that are just approaching 80 years old. And so currently they're going through the process of watching all of their friends either die or be severely debilitated in their latter years by their health and their body. And so I think if you're looking at these kinds of things and these tools, you really just want to ask yourself, what's my strategy for my health? Because at some point, we're going to all make an investment in our healthcare. It's just a matter of when and how we're going to play that game. Truly, unless we, get hit by a bus. I mean, literally, that's what the reality is for most of us, right? So, for example, Fidelity, one of the major, financial advisors out there, recommends, and this is a 10 years ago statistics. It's probably, I imagine with inflation, they used to say it was $150,000 per couple for just paying for the out-of-pocket costs and expenses that came with what they were willing to bet was that one of those two people would get a cancer diagnosis or a major medical situation that they'd have to deal with. And they would need to pay 150, it's probably 200 or 250 now with inflation, for a costly medical procedure in their future. So it's kind of one of those things where you just really want to get real for yourself in terms of what's your stance. I like to call it, what's your game with your health, right? Are you waiting for a major medical diagnosis to get an action on your health and to do some of the things that might be needed that even at your own out-of-pocket cost? Because really the insurance game is only to cover, these major medical events, and then it doesn't cover usually all of it. And so if you really put it in context, it's like you could make a investment out of pocket for your health now that would put you into more of a mode where you're playing the game of prevention. And you'd also get what I call the side effects of that, which is better quality of life, increase expansion and growth for yourself, not being ruled by your body, not being in survival mode because of your body, and having a more abundant and potentially financially abundant, because of the gains in energy and health that you'll receive, oftentimes directly correlates to productivity and contribution in terms of things too. So, though that's just something for you to consider for yourself when you're even looking at some of these bigger questions of, well, my insurance doesn't cover it, Deborah, I'm not saying you're saying that, you're just asking a question, but those are things you want to really examine. Great. What other questions are out there?
Well, people might be thinking about their question. I'll share my personal experience with thermography. And it was that my mom, who's in her 80s, was having some breast discomfort. And her primary care, just at her age, just did not want to put her through a mammogram. He just didn't feel like there was any real risk. And so he said, yeah, take her to do a thermography. So I scheduled her for one, and she was really scared because the only thing she had ever done before was a thermography, a mammogram, I'm sorry. So her doctor didn't want to put her through a mammogram, and I scheduled her for the thermography, and she was thinking in her head that it was going to be just like a mammogram, and so she was scared to do it. So in order to make her feel better, I went ahead and scheduled myself, and so I went first, and then she was like, okay, that was pretty easy, so I'll do it. So she did it, and lo and behold, her test came back wonderful, and my test came back terrible. So I was not expecting that. I had a really poor score on one of my breasts. And so I ended up going to the Women's Imaging Center and doing a follow-up there. Everything came back fine, but I feel like it gave me that, like as you were saying, that early warning sign to say, hey, that you don't have breast cancer today, but there's things going on that need to be addressed, so that you don't develop it in the future. So I've spent the last couple of years just kind of working on some things. There are some things that were noted on my in my mouth, so I've been kind of cleaning up a lot of bad dental work that I had done many years ago. And just now I'm going to go back for retesting, so, and just seeing how everything looks. So just wanted to share that because I really thought I was going to go in there and pass with flying colors, and I didn't, but it was a blessing.
That's awesome. Thanks for sharing that, Naomi. It's really important, I think, to hear those experiences of others. I mean, I know for a lot of us women, it really, with the rates of cancers and breast cancers in particular, I mean, cancer in itself is number one disease cause is heart disease. Number two is cancer, which is one of the reasons why we really introduce this inside of our process as well, because we want to know what's going on and we want to be in action around that. Because again, it's actually known that you can have cancer cells in your body on average up to 7 to 8 times per lifetime. Average person would have cancer cells present in their body on average 7 to 8 times. But one of the challenges is one that we have diagnostics that can actually detect that. And once it's detected, you're going down the path of some pretty serious treatments, that can be effective, but then can also have their own side effects that come with them as well. And so it's really, again, about strategy and what kind of strategy are you taking with your health, and asking yourself that question. And it's really easy for us to go out to dinner on Friday night and drop a couple $100 on a celebratory dinner, but it seems a little harder when we do it out of our pocket for our bodies. And if you really ask yourself, if you don't have your health, what do you have, kind of deal. And so I think it's really important to look at that for each of us, and again, and answer the question for yourself: what kind of game are you playing? Anybody else want to share an experience that they've had with thermography, if they've had one, or have any other questions about how it works? So Diane wants to know, you mentioned diet had changed the tissue in your breasts. So I said nutrition had changed the tissue in my breast, but yes, thanks for clarifying that, Diane, because I think the assumption can mean that just changing my diet changed my breast issues. And I'm going to take that question. Is really, and it's a great segue actually into what I can end with here today. So thanks for being participatory, Diane. So diet alone, if you just wanted to do some things to improve diet itself, cruciferous vegetables are often a great food to make sure you're consuming well enough to improve the removal of excess estrogen in your body. And when it comes to most breast issues, for example, excess estrogen is a big problem. But sometimes estrogen's in excess because progesterone is in deficiency. So these hormones can't be looked at just in isolation of each of themselves. You really need to look at hormones in a more comprehensive level. And that's one of the things we do inside of our office too, is we'll run not blood work for your hormone testing, which is the natural way, or the way that medical professionals will do, is look at hormones. But from a functional medicine perspective, which is really our slant in our practice, we're really interested in looking at it from a urinary perspective, because that gives us a little bit better accuracy on hormone levels and fluctuations. Blood testing alone for hormones is often done to rule in a hormone replacement therapy via a drug therapy. Okay, and so that's an important distinction. But cruciferous vegetables are great, but really it's more complex than that. And then one of the reasons it's so much more complex than that is we've had multiple generations now exposed since our industrial revolution, exposed to some of these chemicals in our environment that have been on the rise. Plastics are a big one when it comes to estrogen aggravators. And so being able to understand what kind of toxicity you have in your body, what those toxic levels are, and then not only understanding that, but really then going through the process of working with a clinician to remove some of those toxins. Often many of us are walking around, especially if we had old dental work, and sometimes even some of the injections we got as a child are have create a situation where we have a lot of excess mercury and or aluminum. And so detecting heavy metal toxicity is a big one to reducing some of the challenges related with breast tissue. And then another one, and I would say I'm saying breast tissue, guys, but that actually, these principles apply to just about anywhere in the body as well. This isn't just about breast tissue. Remember, everything is connected to everything else. So if you had a heavy metal toxicity going on that might be affecting your breast, it's also affecting your liver. It's likely it's also affecting somewhere else. And usually that somewhere else is based off of your genetic profile. So where your weak links are from a genetic standpoint. Okay. And then really looking at even the aspect of encapsulation. And I want to talk to you a minute about encapsulation, because that's oftentimes what you hear as tumor, cyst, nodule, lipoma. Those are all what I call capsules. And the bodies that get intelligence again at play and at work to understand or to deal with a situation that's less than optimal. So your body is actually designed to create a capsule, and it usually does this through the fluid of mucus. Okay, and it creates a capsule around a particular area or of the body or tissue that it doesn't really like, where the cells are maybe starting to have some early changes. And so an encapsulation then becomes really what we see, depending on what tissue it's in, a breast or, a tumor, a cyst, a nodule, a lipoma, sometimes a stone. Those are all encapsulations, and just whatever the material is, that's nearby is what the body uses to create that encapsulation. So the question still becomes, okay, well, if you have fibrous breast tissue or you have a lump or something in your breast tissue, the question is why? What's there that your body would want to actually weave a little capsule around it and contain it, create a container to protect the rest of the body from it? And that's the answer. That's the thing you really want to get to. And so one of the things I said in the beginning is that sometimes I will, and even introduce to you some concepts of maybe what other thermographers wouldn't necessarily say, because some of my colleagues in thermography will say that thermography will get to the root cause of what's going on with that area. And I disagree with that. It doesn't get to the root cause. It gets you to it gets you a better guidance and an idea of where something's happening, but it doesn't answer the question as to why. And so that's what our process, and that's what we do at Paramount Wellness, is we get to the root cause of why those changes would be happening in there, and we help you deal with them through the use of supplementation, herbs, homeopathy, whatever is needed specifically for you and your body. And we don't do it in a protocol way. So a lot of people will want to do a protocol approach for just about everything. And protocols are a great way to sell a bunch of supplements that sometimes may have an effect and most of the time do not. And so one of the ways that we work with people is to really understand what's needed for their particular body, because the reason why your body would potentially create a capsule or encapsulation of something isn't necessarily the same reason why somebody else's would. And so we really want to get to the root and analyze that for yourself. That sets you up then for an efficient and cost-effective way to really deal with that situation, rather than trying to do some kind of, oh, let's clean up your breast tissue protocol approach. We really want to understand, because it's not just isolated to the breast, and it's not just something that will always respond to what worked for somebody else. Hopefully that makes sense. Any questions about that? And that's one of the things that does come along. I'll add, when you do an image at Therma image for the tissue, for an upper body screen, whatever, you will get a free analysis with a practitioner, and then you'll also get an opportunity to take advantage of a discount on services that are related to actually addressing any of those things, which is helpful as well. Great question. Let me make sure. Where does someone find information to correct issues? I think I addressed that, and we do it. We do that and inside of Paramount Wellness. Yeah. Deborah Lee is typing. No pressure, Deborah. Yeah, there is a discount code for when like I mentioned, for an initial consultation or office at Paramount Wellness. The offer I can give you for participating in this particular session for the imaging part is 10% off. So if you decide that you do want to come in for an image and do a thermography assessment, you can just mention that you were on this forum and that Dr. Erica offered you to the 10% discount. And that's something that you can take advantage of. And then the discount for the initial consultation for Paramount Wellness, as a result of attending this, if you're just like, I want to bypass the imaging, or I just did imaging, is a 30% discount. So I'll type that in here. 10% off imaging service. And 30% off. And this is if you book within the next week, or you've got some other health stuff going on that you just want to take a look at through our process, because this is it works for many other scenarios. These are both yeah, they're both in Englewood, Colorado, like I mentioned. And then 1 week, you don't have to book and come in within a week, guys. You just need to call our office.
And I will drop the website on the chat as well. We have just a couple more minutes. Maybe if you could address lymphatic congestion that you might see in those black and white images.
Yes, yep. Lymphatic, thank you. That's actually something I did want to talk about and forgot. So one of the most important things you can do for not just your breast tissue, but quite frankly, the lymphatic tissue is everywhere in your body. And in particular, in high concentrations around the neck, the clavicle area, and the groin, the abdomen. And so one of the things that I like to do with people is just because most of our congestion, a lot of our congestion can be up in this area, and then certainly in the breast tissue as well. There's concentrated areas of lymph inside of each of those armpits as well. So I always like to get people into a regular habit of doing some lymphatic work with their body. And guys, you can Google that on or put that on YouTube and find some excellent videos on how to do lymphatic therapy. And it can get very complex very quickly. And so what I would offer you on this session is to simplify things is really just start with underneath your clavicle bone here. And you can even probably run your fingers along just underneath your collarbone. It's really, the clavicle is right up along the neck here, also known as our collarbone. It usually has a protrusion right here. But just kind of even feel underneath there and you'll be able to feel some tender areas. Once you've found that, you almost want to obnoxiously, you just like lightly move your fingers over that. And the reason why it's so light is because the lymphatic system is the drainage for our nervous systems, for a lot of toxins that are coming out of our muscles. If you press too hard, then you're actually starting to get into the muscle level. And so it's like wringing out a dirty sponge into dirty water. So just start really obnoxiously with just fingertip, really light touch. And you'll see after just doing that for a couple minutes, you'll feel that initial tenderness go down. Well, that's what I call opening up your drains right here. And then that's when you can start using a dry brush. And you always want to direct towards the heart. Okay, so you can start on the inside of the arm, go up into the armpit and over towards the heart. You can also, we use tools like gua sha tools. And then we have a little vibrator tool that you can use on your cheeks and your skin that takes the, a lot of the effort out. You just press it on the different areas and it helps to move the lymph as well. Really important aspect because again, it's one of those systems in our body that is used commonly for detoxification and really overlooked. But it's really great to get into a habit of that. So guessing imaging done first. Yep, you get the image done first, Deborah, and then we'll do a free little session for you afterwards, about 15-minute long, where we go through the report with you and answer any questions you might have. And then from there, we would set you up for an initial consultation to look at how do we handle anything that comes up in the imaging. What are my thoughts on infrared therapy? It's great. It's great on Instagram. It's great when it's used at the right time. And so oftentimes we're trying to use tools and biohacks or, these technologies, and we're using them at the wrong time. And by that, I mean, like, if you have a lot of inflammation or a lot of excess heat going on in your body currently, going into a sauna or into a scenario where the like infrared therapy itself is good because it's used in a penetrating way. But oftentimes many people can't do any excess heat. So it needs to be in a manner where you can be strategic about the temperature aspect of it. And then that goes for cold plunging too, because oftentimes if you've got, like I mentioned, chronic inflammation or chronic scenarios, chronic conditions going on, you have cold retention inside the tissue. So over time, just doing cold therapies alone would aggravate that scene. So all of those things that come with a temperature, either hot or cold, you want to make sure you're using it at the right time. And then anything that you're trying to do that would help penetrate, you want to make sure the cells and the tissues are cleaned up enough, because you don't necessarily want to penetrate toxins further. You want to do those things at the right time, is what I'd say. So the infrared therapies, the cold plunging, all of those things alone are not going to help you achieve necessarily better health or tissue changes necessarily that sustain long term. You got to get to the root cause of why there's that excess heat in the body that would make you feel good after a cold plunge, and vice versa.
Excellent. Well, excuse me. Thank you so much, Dr. Erica. Thank you, everyone who participated. Appreciate the time. This was super, super interesting. Yes, thank you.
Awesome. Thanks, guys. Appreciate you all. Do you want me to stay on, Naomi, or are we good to hang
Sure.
up?
Yeah.
Okay, I'll be here for a minute. If anybody else has any questions that they want to ask.